Greetings from the World Health Organization. I'm Dr. Soumya Swaminathan, the Chief Scientist, and I'm delighted to share some thoughts with you all today. Many thanks to Survivors Against TB for having invited me to speak to you all at this very important seminar that's really addressing the intersection of science and the challenge of TB. I don't need to tell this audience about the burden of TB globally. The WHO estimates that there are at least 10 million new cases every year and about 1.5 million deaths. We know that in India, we had 2.3 million notifications. Last year was less, and over 1,200 people continue to die every year due to TB. And this has been going on for many, many years, even though there has been a decline in incidence and in deaths due to TB in the last 10 to 15 years. It certainly hasn't been fast enough. And, we're still losing a lot of lives. The other thing, of course, is that TB affects those who have other vulnerabilities and other risk factors for ill health, particularly in India. Malnutrition is a huge underlying risk factor for TB. Of course, other immunosuppressive conditions, HIV, infection, and then lack of access to hygienic living conditions, tobacco, all of these. So there's a clear link with poverty and TB. And what is really worrying is that the impact of COVID on livelihoods and the economy of individuals and families and countries means that it is quite likely that income will be reduced, particularly for those who are already at the bottom end and extremely vulnerable to these kind of shocks. And when income goes down, nutritional status will suffer. And unfortunately, TB incidence could go up. And some of the personal behavioral actions that we have been taking during COVID, like wearing of masks, maintaining distancing, making sure that we cough into our, all of this could actually help to control transmission of TB as well. But that's a more longer term impact. And therefore, if we have to continue to meet the SDG goals, as well as the accelerated goals that India has of TB elimination by 2025, then we really need to focus on what we can do better and what we can do better now. And this, I would like to touch on at least 3 elements. One is doing better with what we have now. The second is looking at science and what it can deliver. And the third is looking to communities and looking at how do we improve the risk factors, how do we address the determinants of TB at the level of the community, and how can we work with communities and engage communities to make sure that the response is equitable, it's fair, it's accessible, and that it also takes into consideration the needs of particularly vulnerable groups like the LGBTQ community and women and children. What's been remarkable in the past year, especially sitting at the WHO and having a global perspective, the one bright thing that's come out of all of this, the uplifting element, has been the contributions of science. And it's become so clear to everyone that the solution for this pandemic can only come out of science, whether it's the development of new diagnostics or drugs or vaccines. And the incredible achievements we've seen, particularly in the field of vaccines, where we have not 1 or 2, but at least 10 vaccines that have completed phase 3 clinical trials, that have been registered for use in countries around the world, and that are now being used in millions of people. In fact, as of yesterday, over 250 million people worldwide had received a COVID-19 vaccine, and India can take a lot of credit for not only manufacturing these vaccines, but also a number of innovative products that are coming out of the Indian developers, and the fact that India has now launched what will surely be the largest COVID vaccination program in the world. So, how did this happen? It happened because there was a goal. It built on pre-existing investments in R&D. So there were already these platform technologies like the viral vector, adenoviral vectors, and the mRNA platforms that people had been trying to develop vaccines for other pathogens. They were able to quickly repurpose, and within a few weeks of the genetic sequence of the virus being known, they were able to actually develop a candidate vaccine and start testing it. And then, of course, it also went through very accelerated timelines. Things were done in parallel instead of sequentially. Big investments were made by governments and companies into manufacturing at risk, which means that you start manufacturing even before you know whether the vaccine is successful. And now, of course, we know that we are going to need billions of doses of these vaccines in order to achieve population immunity across the world. But I think the learning from this is that if you have a goal, you have a focus, you have the public-private collaboration, you have the resources and the funding, and the regulatory system, the academics, the developers, the government agencies, all working together for the same goal, there is no reason why we cannot do the same for TB diagnostics or for TB vaccines. And I think there's an opportunity now using some of these platforms, particularly the mRNA platform, where you can insert the genes of interest. We know that TB is much more complex disease and that it's been very difficult to find an effective vaccine because of the complex immunology involved. But should be still possible to identify the key antigens which might provide protective immunity, quickly develop a vaccine, take it through early phases of clinical trials, and at least get information on whether it is likely to be protective or not, and then go into the larger phase 3 trials, which again for TB are complex because we're looking for disease, and disease as an endpoint is often challenging because it takes time when we follow up that cohort. It is possible. Similarly, in diagnostics, we've seen that so many rapid diagnostic tests, so many molecular diagnostic tests were developed over the last 1 year, and today we're in a position to have a self-testing program for COVID-19. There is no reason why those technologies, including many developed in India, cannot now be reprogrammed for TB. Again, it's complex. We know that the detection of TB in non-respiratory specimens is difficult. There isn't a lot of circulating antigen, but still, I think it's possible to at least try to use some of these new technologies and make it, test it at scale for TB. And India has demonstrated over the last year that its private sector, working along with government and the public sector, is very, very capable of rising to the challenge and addressing whether it's been shortages of PPE or whether it's been in some of these innovative products. And the last thing I would say is the use of digital tools, which have made contact tracing and tracking and symptom tracking and providing information to people, and now currently tracking vaccination. All of this has been possible using digital tools, and therefore that can also be now tried for TB. In all of this, the role of communities of survivors is extremely important. You're the champions. You're the ones who understood what the disease is, having gone through it, and are in a position to help others and also to bring your viewpoint. It's really important to have that new tools are being discussed or are going to be tested. And finally, as I said, we need to keep in mind that whatever we are doing needs to benefit those who are really the furthest away, who are the least accessible, who are the most vulnerable for one reason or the other, whether it's because of stigma or particular group that they belong to, LGBTQ, or whether it's because of other social or economic constraints. And so we need to ensure whatever we do that the equitable access is there right from the beginning as a goal. That's what we have at the global level, equitable access for all COVID tools. And that's what should happen within countries as well, to ensure that all segments of the population benefit from the investments that are being made. I hope that you have very useful discussions, and I would be delighted to keep in touch and to continue to engage on how do we link science and what we've learned the COVID to make similar gains in TB. Thank you.